Okay.
I was in Vietnam. I came back, and I don't go around shooting people's wives.
Redmond says that he is a veteran and that he is suffering from post-traumatic stress disorder. Now, our Bobby Liga looked into that a little bit more tonight. He's live in the studio. Unfortunately, a common disorder.
Lisa, statistics say 1 in 3 troops returning home are being diagnosed with PTSD. I spoke with a clinical social worker who tells me it's a psychological disorder that happens after experiencing a life-threatening or traumatic event.
A situation that's kind of what you consider horrendous or something that most people don't see. It could be like seeing someone die. It could be rape.
Frank Roos is a clinical social worker who deals with PTSD patients, many of them veterans. Statistics show 1 in 3 service members returning home are being diagnosed with serious PTSD.
Being under the chronic stress of being in a combat environment or being in a super stressful environment actually makes changes to the brain.
Roos says PTSD changes the way people react in social situations.
You're consistently running on that fight or flight part of the brain. So when you get back to the States, it's sort of like you're still running in that combat mode. So when you come back to the States, it's kind of hard to make adjustments.
Roos tells me some symptoms for the disorder are re-experiencing symptoms where the person may have flashbacks from a traumatic experience. Noises or certain locations can remind the person of a bad experience in the past. This can result in nightmares and irritability.
You get quick to anger, which, little things set you off. The lack of sleep because you can't sleep makes you irritable and cranky.
Roos says local veteran organizations offer therapy to help people cope with PTSD.
The VA is doing some fantastic therapies with cognitive processing therapy, prolonged exposure therapy. Does it go away? Is it cured? I'd probably say never, but you can learn to live with it if you have some good therapies, and you learn and you face it.
Some therapy for PTSD has the patient think differently about the traumatic experience and focuses on dealing with anger, depression, and fear due to the disorder. Back to you.
Thanks, Bobby. And if you suffer from PTSD and need immediate help, the VA urges you to call 911. There are also some non-emergency lines that you can call as well. We have those posted on the story on live5news.com.